Today, we address a critical issue impacting healthcare nationwide, the sterile IV fluid shortage. This disruption stems from Hurricane Helene, which forced the closure of Baxter International's manufacturing facility in North Carolina on September 29, 2024. Baxter supplies 60% of the nation's IV fluids, and their plant's shutdown, combined with damaged infrastructure, has left healthcare facilities scrambling. According to a Premier Incorporated survey, over 86% of providers report shortages, with 88% receiving less than half of their fluid orders. Small facilities, particularly those with fewer than 25 beds, are struggling the most, with some receiving none of their orders. IV fluid shortages are not new, but the scope and duration of such disruptions are growing. A new report reveals that medication shortages can last up to 3 years, far beyond the typical inventory planning of 15 to 22 days. Many hospital pharmacies operate on a just-in-time inventory model, which minimizes excess stock but leaves little room for emergencies like this. Strategies such as buffering critical supplies and collaborating with wholesalers are now being considered to mitigate the impact. To address this crisis, Baxter is airlifting tens of millions of IV fluid units from international facilities in Thailand, Singapore, Canada, and other countries. Additionally, the FDA has approved extended shelf lives for more than 50 IV and irrigation products. Compounding guidelines have also been relaxed to allow state-licensed pharmacies to create essential solutions. Meanwhile, B. Brown Medical, the second largest supplier of IV fluids, is ramping up its production and assisting in inventory replenishment. As anesthesia professionals, we must play a proactive role in managing this shortage. Here are highlights of several key conservation strategies recommended by the American Society of Health System Pharmacists. Develop a substitution policy based on available supplies. Transition patients to oral hydration whenever possible. Discontinue IV infusions promptly. Use smaller volume bags for low infusion rates. Use catheter locks and flushes, and avoid keep vein open. Reserve specific IV products for critical situations. Avoid pre-spiking bags unnecessarily. The good news is that Baxter has restarted its highest throughput manufacturing line in North Carolina, with distribution expected to begin mid to late November. While this is a promising development, it's clear that collaborative strategies across anesthesia teams, pharmacy, and leadership are essential to navigate the ongoing crisis. Stay informed and continue to adapt your practice to ensure the best outcomes for your patients. For more details on managing the IV fluid shortage, visit the Anesthesia Patient Safety Foundation's website or consult your hospital pharmacy team. Together, we can mitigate the impact of this challenge.